Viewers, I am Dr. Farrington, Homeopathic consultant. Welcome to my Homeopathic medicine channel. Viewers, today I shall describe about Revolution of Homeopathy Series 2 by Dr. M.L. Sehgal. Sulphur Homeopathic Medicine, Selection by Easy Oil or Selection Sulphur Remedy by Sehgal Method, ROH. Patient number 1, patient with cervical spondylitis, says, I am of the firm belief that I will get relief, but I just fear one thing, and that is pain. Doctor, why? Because it causes weakness, and as a result the body cannot function properly. This I don't want to happen. This version is covered by 3 rubrics in Sehgal method. Number 1, hopeful. Hopeful means feeling inspiring to succeed. Number 2, fear poverty of. Here fear loss of everything. Number 3, mood repulsive. Repulsive means causing a feeling of loathing, aversion, disgusting. Viewers, if we do repertorization, we found here 3 rubrics: patient's alternative mental state. Number 1, hopeful. Number 2, fear, poverty of. Number 3, mood repulsive. The general medicine for this rubric is sulphur. Patient number 2, a patient with cervical spondylitis, says, when the pain becomes intolerable, I become quiet and try to rest so that I should get rid of the trouble caused by pain. I believe that it will get relief, but become embarrassed when it requires time and again. In Sehgal method, this version covered by 3 rubrics. Number 1, quiet wants to be repose and tranquility desire. Number 2, hopeful. Number 3, embarrassed elements after. Embarrassed means causing mental discomfort or anxiety to somebody, cause somebody to feel awkward or ashamed. Viewers, note that if we do repertorization, we found here 3 rubrics: patient's alternative mental state. Number 1, quiet wants to be repose and tranquility desire. Number 2, hopeful. Number 3, embarrassed elements after. The general medication for this rubric is sulphur. Patient number 3, a patient with cervical spondylitis, says, any physical or mental exertion shakes my balance to composers, and I feel like withdraw from all types of activities and need rest for some times or sleep to recap myself. After that, I back to myself. Otherwise, I get married with everyone. In Sehgal method, this version covered by 2 rubrics. Number 1, irritability exertion from. Number 2, quiet wants to be repose and tranquility desire. Viewers, note that if we do repertorization, we found here 2 rubrics: patient's alternative mental state. Number 1, irritability exertion from. Quiet wants to be repose and tranquility desire. The general medication for this rubric is sulphur. Patient number 4, a patient with cervical spondylitis, says, I get angry too often. I know that it is a bad habit. Why cannot I always remember the child are not naturally naughty, and that is not becoming of me to get offended with them. I don't want to behave like this way. I really feel bad about it and also know this is harming me. This version covered 3 rubrics in Sehgal method. Number 1, anger alternating with repentance quick. Number 2, repulsive mood. Repulsive means causing a feeling of loathing or aversion, disgusting. Number 3, delusion injury being injured is. Viewers, note that if we do repetization, we found here 3 rubrics: patient alternated mental state. Number 1, anger alternating with repentance quick. Number 2, repulsive mood. Number 3, delusion injury being injured. The general medication for this rubric is sulphur. Patient number 5, Doctor, see how thin I am getting day by day and feel it even more when I talk. Even a little talking gives me a feeling great weakness. This version covered by 2 rubrics in Sehgal method. Number 1, delusion thin he is getting. Number 2, talking complaints or aggravates. Viewers, note that if we do repetization, we found here 2 rubrics: patient's alternated mental state. Number 1, delusion thin he is getting. Number 2, talking complaints or aggravate. The general medication for this rubric is sulphur. Patient number 6. Patient says, I feel I will get oil every time before I talk but take the medicine. But when I get not relief, I get disappointed and embarrassed. This version covered by 2 rubrics in Sehgal method. Number 1, hopeful. Number 2, embarrassed. Elements after. Embarrassed means cause mental discomfort or anxiety to somebody, cause somebody to feel awkward or ashamed. Viewers, note that if we do repetization, we found here 2 rubrics: patient's alternated mental state. Number 1, hopeful. Number 2, embarrassed. The general medication for this rubric is sulphur. Patient number 7. A patient with cervical spondylosis says, I am in much trouble and is somehow affecting me. I feel like resting most of the time and need nothing else. This version covered by 2 rubrics in Sehgal method. Number 1, delusion injury being injured is. Number 2, quite wants to be repose and tranquility desires. Viewers, note that if we do repetization, we found here 2 rubrics: patient's alternated mental state. Number 1, delusion injury being injured is. Number 2, quite wants to be repose and tranquility desire. The general medication for this rubric is sulphur. Patient number 8. A patient with cervical spondylosis says, I don't bother about my work. What I want now is to lie in a peaceful place and take rest. This version is covered by 2 rubrics in Sehgal method. Number 1, business neglected his. Number 2, quite wants to be repose and tranquility desires. Viewers, note that if we do repetization, we found here 2 rubrics: patient's alternative mental state. Number 1, business neglected his. Number 2, quite wants to be repose and tranquility desire. The general medication for this rubric is sulphur. Patient number 9. A millionaire says, I cannot part with the money. Once I put the money into the bank, I don't bring it out, as I always want to feel wealthy and not poor. The fact is that even for paying bill, I wait for dues coming from the other sources to avoid spending. Withdraw money from the bank means Escaping my own flesh. This version covered by the 3 rubrics in Sehgal method. Number 1, avarice. Avarice means greedy for wealth or gain, an excessive desire to gain and what? An extremely strong desire for money and positions. Number 2, delusions, wealth, imaginations of. Number 3, fear, poverty of. Viewers, note that if we do repetization, we found here 3 rubrics, patient's alternated mental state. Number 1, avarice. Number 2, delusion, wealth, imagination of. Number 3, fear, poverty of. The general medication for this rubric is sulphur. Viewers, thank you for watching my video. For regular update, please like, comment and share and subscribe my channel. Thank you.